For decades, Kashmir has been globally recognized as a landscape defined by intense geopolitical friction and unrest. For the people living there, that friction creates a daily environment where a heavily armed military presence is ubiquitous. It also leaves permanent, physical scars on the landscape, the persistent rubble of destroyed infrastructure and crumbled property. We are conditioned to look for this loud, visible destruction when looking at a conflict zone, but this focus masks a much quieter, more insidious devastation unfolding behind closed doors. Deep inside Srinagar's hospitals, a new demographic is emerging. Young girls, some only 15, are traveling in secret, desperate to remain anonymous. They aren't arriving to treat the physical wounds of war. They are seeking help for severe cannabis and intravenous heroin addiction. This rapidly escalating public health emergency is staggering. In 2016, the Institute of Mental Health and Neurosciences reported 489 drug abuse cases. By 2019, that surged to over 7,400. Today, over 25,400 people are registered as drug abusers in the region. How did a highly conservative society produce an opioid epidemic among its youngest women, entirely under the radar? A perpetual conflict zone is built on constant systemic shocks, widespread unemployment, sudden disappearances, and the daily threat of violence. This environment takes a severe psychological toll. Nearly 45% of adults in the Kashmir Valley report experiencing symptoms of acute mental distress. Clinical conditions like severe depression, chronic anxiety, and PTSD have become a normalized part of the daily experience. Constant exposure to trauma without proper psychological relief leaves an entire population desperate for a way to numb the pain. Vulnerable young minds, lacking healthy outlets for their distress, often turn to easily accessible substances to silence insomnia and panic. These patterns typically begin with prescription depressants and cannabis before escalating toward the brutal dependency of intravenous opioids. A patient named Saba traced her dependency back to the mental decline and arrest of her brother during the height of the regional unrest. She began taking medicines to calm herself down. Today, she struggles to stop using cannabis. For Saba, and thousands like her, addiction functions as a direct chemical survival strategy, a way to manage the demands of a volatile, deeply stressful environment. Intense gender-based pressures and societal shame force these women to hide their struggles, creating a massive barrier to recovery. They travel miles to Srinagar to avoid being recognized at local clinics, choosing long, difficult journeys just to maintain their anonymity. Upon arrival, they find a support structure in crisis. Srinagar's mental health infrastructure is strained, suffering from a desperate lack of female psychologists and counselors. Many girls with severe trauma refuse to open up to male therapists. This lack of gender-specific care leads to failed interventions and frequent relapses. The weight of societal stigma, combined with an inadequate medical system, creates a silent spiral that many feel they cannot escape. Breaking that spiral is an agonizing physical process. Opioid withdrawal brings severe pain, deep depression, and cravings so intense they make recovery feel impossible. Yet, as the numbers grow, a perceptible cultural shift is beginning to take place. Stigma is gradually eroding as more brave young women step forward to demand therapy and treatment, seeking community and resilience amidst the destruction. Seeking treatment in this environment is a significant act of defiance against both a chemical dependency and a cultural taboo. Srinagar's high-density neighborhoods house a population carrying a weight that isn't always visible from the air. A military skirmish or a destroyed building provides a tally of immediate loss, yet the deeper psychological erosion often goes unrecorded. The lasting cost of conflict is measured decades later, hidden in the quiet, desperate coping mechanisms of young people trying to survive the psychological rubble.